So I'm going to walk into the room, and before you start your assessment, you just want to make sure that you have a postpartum mommy with a fundus and panties and a pad. So we've already checked that, so we've got the right patient down there. And then I'm going to make sure that I've got all the right materials. So I've got my stethoscope, my patellar hammer, and my gloves. And I'm going to walk into the room. I'm going to introduce myself. Hi, I'm Lindsay. I'm going to be your student nurse from Indiana Wesleyan. Could you please tell me your name and date of birth? And I'm going to check her ID while she tells me.
My name is Taylor Burns. I was born in 8/11/90.
Okay. And do you have any allergies, Taylor, that we should know about?
Yes, I'm allergic to betadine and KY jelly.
All right. Good. And those are all accurate. I'm going to raise the bed so I'm ready to do the assessment here. And while I'm doing this, I will just state that her vital signs have all been taken already, and they're all within normal limits. And while I'm doing this assessment, I'm going to be assessing her level of consciousness and her communication being appropriate throughout the entire assessment. And I'm just going to start by asking you, Taylor, how are you feeling today? Did you sleep well last night?
I'm doing pretty well. I was kind of sweaty all night.
Okay, so night sweats, they're pretty common right after delivering because you've lost so much blood and fluids, but that should go back to normal pretty soon and you'll be feeling good and sleeping better. And are you experiencing any pain right now?
I have a little bit of pain.
Okay, could you tell me where that pain is?
It's kind of like in my lower belly.
Okay, and could you describe that pain? Is it sharp or is it dull or stabbing? What's that
It's
feel
pretty
like?
dull.
Okay, on a scale from 0 to 10, 0 being no pain at all and 10 being the worst pain you've ever experienced, what would you rate that pain?
I would say it's a 3.
Okay, and is it consistent or is it intermittent, like leaving every once in a while?
It's kind of intermittent.
Okay, and is there anything that makes it worse or better?
Yeah, it gets a lot worse when I get up and walk around.
Okay, and that's pretty normal after delivery. Is there anything, do you need anything for the pain right now?
I'll just try to rest up today.
Okay, alright. And are you experiencing any headaches right now, Taylor?
No, I don't have a headache.
Okay, what about any like little floaters in your eyes or spots before your eyes, anything like that?
No, I don't see any of those.
Okay, great. I'm going to start with the assessment, so I am going to listen to your heart. And I'm going to listen to the 5 key points on her heart. So I'm going to state those off for you. First, we'll listen to the second right intercostal space, which is the aortic valve. And then we'll listen to the second left intercostal space, which is the pulmonic valve. The left lower sternal border, which is tricuspid valve. And the 5th intercostal space at mid-clavicular line, which is the mitral valve. And the 3rd left intercostal space, which is Erb's point. So after listening to those 5 locations in her heart, I would note that the heart has a normal rate and rhythm. S1 and S2 were both heard, and it's possible that S3 could also be heard after delivery just because of the increased blood volume. So your heart's sounding good, and now we're just going to listen to your lungs. So I'm going to have you breathe for me each time I put this on your chest wall. So first I'm going to listen to the right upper lobe. Just breathe in and out. And the left upper lobe, in and out. And the right middle lobe, in and out. The lower right lobe, I'm going to lift up her breast to listen to that, in and out. And the lower left lobe, I'll lift up her breast again to listen to that. Okay, and breath sounds are clear bilaterally, and her respirations were normal at a normal depth and a regular rhythm. And Taylor, are you breastfeeding right now, or are you bottle feeding?
I'm breastfeeding.
All right, great. How is that going for you?
It's going good.
Okay, wonderful. Are you experiencing any tenderness in your breasts or pain right now?
Not really.
Okay, do they seem to be filling regularly?
Yeah, they're filling up.
Okay, and feeling heavy?
Yeah, they're heavy.
Okay, those are normal feelings. I'm going to check to make sure she's wearing a form-fitting nursing bra right now, which she is. And then I'm going to pull down her shirt and just inspect her breasts and her nipples. The bra should be wireless. So then I'm going to pull down her shirt and inspect her nipples to make sure that they're intact. They shouldn't be red or tender right now. Breast should be soft, and I'm going to ask her if the colostrum is expressed, and if she's having any difficulties with any of that. Her nipples should become erect when they're stimulated, so I'll be assessing all those things. And then if she wasn't breastfeeding, I would remind her to be wearing a tight bra that should be wireless as well. So now we're just going to move on to the gastrointestinal system. So when was the last time, Taylor, that you had a bowel movement?
I had it the night before I gave birth.
Okay, so that's 2 days ago. And it's normal for your bowel functioning to come back, to return by the second or the third day after delivery. So hopefully you'll be feeling better soon. And I'm just going to listen to your bowel sounds right now. So I'm going to start, and I'm going to follow the gastrointestinal tract. So I'll start in the right lower quadrant and move to the right upper quadrant, and then the left upper quadrant, and the left lower quadrant. And bowel sounds are all present and normal active. And now I'm going to palpate after listening. I'm going to palpate her liver in the right upper quadrant. So could you tell me if you're experiencing any pain right now?
No pain.
Okay, good. And do you have any heartburn?
Nope.
Okay. If she was a C-section patient, I would be assessing her incision right now on her belly, and I would be looking for RETA, which is redness, ecchymosis, edema, drainage, and approximation. So I'd be assessing all those things. And now I'm going to just move on to your arms. And so we'll start here. I'll I'll feel for a radial pulse bilaterally. And that's present, and then I'm going to check her capillary refill. It should be less than 2 seconds here on both sides. And at this time, I'm just going to look at her IV site. She's got a lock-in right now. And so I'm just going to make sure that that's patent, that it's looking all right, no redness or swelling around that. And if she did have an IV bag hanging, or if any meds were hanging, I would be checking those for the 5 medication rights, which are the right dose, the right time, the right drug, the right route, and the right patient. So got all those. And I would also be checking right now to make sure that all the tubing is labeled correctly. So now we're going to move on to her lower extremities. So pull down the sheets here. And I'm going to be looking at her feet. So I'm going to assess pedal pulse on both sides here. Present bilaterally. And I'm going to check for capillary refill. It should be less than 2 seconds on both sides. And I'm also going to be looking at her legs, checking for edema here right now. So she's not experiencing any edema, which is great, but if she was, I would rate it on a scale from 1+ to 4+ for pitting edema. And I would see how high up the leg it goes, and to make sure that it's symmetrical, and I would just be assessing that throughout the shift. And now I'm going to check her deep tendon reflexes. So I'm going to put my hand support behind her knee. I'm going to take my patellar hammer, and when I'm ready, I'm going to strike the patellar hammer under her patella and above her tibia in that little groove there. So we'll just hold it here, tell her to relax, and I'm going to hit here. And then I would assess the reflex there and grade that, and I would do that bilaterally. And then I'll move on to clonus. So I'm going to hold my hand behind the back of her ankle. I'm going to tell her just to relax, and I'm just going to rotate her foot a little bit, just to help release any tension that might be in there. And so I'll rotate, and then I will snap back, and I'll see if there's any bounce, which would be the clonus. So one bounce would just be 1 beat of clonus, and I would check that bilaterally. And at the same time, I'm going to dorsiflex her foot here and ask her if she's experiencing any pain in the back of her calf, and that would be checking for Holman's sign. So I would do that bilaterally as well. And at this point, I'm going to put on my gloves. And Taylor, can you tell me if you're having any trouble peeing, going to the bathroom that way?
No, I just went about 45 minutes ago.
Okay, great. And it's normal for a mother after delivery to have up to 3,000 milliliters per day of urine, and that will decrease over time. If she had a Foley catheter, I would take this time to check that, to make sure that that's intact, I would assess her urine, make sure that it's clear, pale yellow, odorless, and yeah, so I'd be checking that. And I'm going to come up here, I'm going to pull down her panties and bring them down to her ankles. Alright, and I'm going to spread her legs apart some here. And I'm going to make sure that her pad is placed under the perineum as we're doing this assessment here. I'm going to observe how much lochia is on her pad. She's got about a scant to moderate amount of lochia there. It's rubra, which is the dark red, and that's the normal color for 1 to 3 days postpartum. She doesn't have any clots, which is good. And can you tell me when the last time was that you changed this pad?
I changed it about 45 minutes ago when I was in the bathroom.
Alright, so she's doing good. That looks normal. And I'm going to assess her fundus right now, so I'm going to put my right hand on the lower uterine segment. And so I'm going to support that, and I'm going to take my other hand, I'm going to find the top of the fundus, and it should be midline, and it should be at the umbilicus and centered, which it is, so that's great as well. I'm going to feel, it feels firm, I'm going to massage a little bit, and then I'm going to express, push down once, and I'm going to observe how much lochia is expressed. She just had a scant amount expressed, which was good. If her uterus was boggy or really soft, or if she expressed a lot of lochia, I would continue massaging until her uterus became, or the fundus became firm, or until the bleeding stopped. So I'd be checking for all that, and now I'm going to turn her over. Just going to turn you here, Taylor. At this point, I'm going to check for hemorrhoids on the back. She's not having any hemorrhoids. I'm going to separate the labia here and check for her episiotomy site or lacerations to see how that's healing. And I'm going to assess for RETA, which is the redness, ecchymosis, edema, drainage, and approximation once more. So she's looking good there. And this time we'll also, since we're on her back, we'll check her epidural site. So we'll check to make sure that her skin is not breaking down there at all. She doesn't have any major hematomas or serious bleeding back there. So I'll assess all that, and she looks good. I'm going to turn you back onto your back here. We will pull up your panties. And as I've done this whole assessment, I would just state that she appears to be fully conscious. She's got appropriate communication as we've talked, and she's answered my questions, so I would mark that on her chart. And I will just lower the bed then when I'm done, and that's it. So I'll take off my gloves, throw it away. And we'll put the bed down, and I'll make sure that her call light is within reach, and I'll see if she needs anything else, and that's it. Thank you.